right, well, welcome. This is Videocast number 2. I'm Sam Coffman, and today I'm really pleased to be able to have a guest, and that guest is Kyla Helm. We're going to be talking a lot about nutrition. We're going to be talking about some of the different courses she's teaching, as well as just her background in general and where nutrition really plays a huge role in our health, in our day-to-day health, as well as overall as a society, as really, as a culture, and all of the things that kind of go into our food, what we would consider our modern version of hunting gathering, and in aisle 13 of the grocery store. What exactly is that we're doing? What are we putting into our bodies, and how does that overall affect our health? Certainly on a chronic, in terms of chronic disease and long term, but also in terms of just even short term and acute presentations of things that happen. So really nutrition and health. So I'm very, very happy to have Kyla here. I'll get back to her in just a second. Before I do that, let me go ahead and just give a quick advertisement of what we've got going on here. This is Kyla's class right now that's going on, the basics of functional medicine and clinical nutrition. This is part 1 of what is of what there is a second part to, so this is sort of the basic course, and it gets into more advanced there, and we'll talk about that today too here. This is a course we've taught before, and I really if I could have, I would have made it a requirement for anybody taking the clinical herbalism course, for anybody taking even the emergent responder, certainly the family course. I think that this is absolutely vital information. But because this started afterwards, what I've done is it's a separate, kind of a separate track of its own, and I highly recommend this course. We've had people that have a Bachelor of Science in Nutrition. I think I've told you this before. We've had people come in here that literally have spent 4 years studying nutrition in college that came out of Kyla's course last time around and says, I cannot believe how much information I learned that I did not know. So it's an incredibly good course. And that's going on. There's still time to register for that. Also going on right now is the Emergent Responder course. This is the second semester of it. You can still jump into this. This is the last. There's 3 semesters to this class, and this is the last. This is the only semester you're going to be able to do without having done the first semester. If you want to jump in next fall to the 3rd semester, you're going to have to wait and do semesters 1 and 2 first. So this is kind of your last chance to jump in if you're interested in this program. Also an amazing program taught by Katja Swift. And I jump in, I do a few of these, I do a few of the classes as well. And this will culminate with a hands-on exercise next year. That'll be a 5-day exercise. This involves a lot of different training that has co-requisites to it, not just what we're teaching you here, but also what we need you to go out and get on your own, although it's free, for things like FEMA courses, CERT certification, HAM certification, and all of that culminates, and we pull that together and integrate that not only into our 3rd semester, but also into the hands-on training. So this is, if you're interested in herbalism in a post-disaster or an off-grid situation, this is the course that I would highly recommend. And it's not just herbalism, of course, it's all the other things that blend into how do we deal with a post-disaster situation for our neighborhood, for our community, or helping other communities. Okay, so with that said, let's get into it then. So Kyla, welcome. We're so happy to have you. I'm really happy to be able to talk to you today about nutrition, and I'm really happy to know you and to be able to confer with you on things that we talk about and to have your help. So welcome.
Awesome. Thank you. Thank you for having me. I appreciate it.
What I'm thinking is, I'd like to talk about your background, specifically in medicine. And I know you started in the military, you started in the Army, as a doctor, right?
I did. Yeah, I did. Just did my regular training in a civilian medical school, and then I did my residency training in the Army, and then spent 8 years in the Army. And during that time, I just did regular traditional family practice medicine. And got out and knew from the time that I was in the Army that regular medicine didn't make a whole lot of sense to me. I did it because that's what I was trained to do, and charged on, as a good soldier does. But kept asking why and how does this fit together, and was fortunate enough to I was at Fort Huachuca. I was a civilian at that point as a contractor, and had a had a pharmacist walk in and was talking about bioidentical hormones and stuff that I'd never even heard of before, and listened to her and just started taking my first wobbly steps in functional medicine, doing some basic hormone therapy, and realized that people were, for the first time, were actually getting better. And so that sparked me to kind of look further into, how we were doing medicine, why we were doing medicine the way we were doing, and that led me down the functional medicine route, and I ended up getting first board certified in functional restorative medicine, and then I went through a fellowship program through the Academy of Anti-Aging Medicine, which is now the metabolic medicine, I think is what they call it now, but got my fellowship through there and have been doing functional medicine ever since. And so it's been great turnaround, because for the first time when I started doing it was when medicine made any sense to me at all. So that's how I got where I'm at.
Yeah, I remember we were talking once when I first met you, which was now I think 4 years ago, something like that, maybe a little longer.
Yeah, 4 or 5 years ago. Yeah.
You were mentioning that you had done some work over in Africa with some communities over there, and how I was totally relating, because I could relate to my own military experiences of going to some place where people are highly underserved. They're both nutrition, of course, and medicine, and then passing out antibiotics and steroids like they're candy. And then 2 weeks later, they're basically back to where they started. And so that was the first time I totally related, because you were basically mirroring something I'd been saying too for quite a time.
Right. Well, that even, and I went to a lot of different places like Nigeria and Peru, and that's it's all we did. We had this big group of docs who got together, and not a big group of docs, but a big group of providers, and that's what we did. Is we had this very short term. Okay, we're going to hand out deworming medicine and antibiotics, and that's it. And then we left, and I thought, wow, that doesn't make any sense. But that's not a whole lot different than what we see in a regular clinic here in the United States, right? You come in with an acute problem, if you're lucky, and you get an acute medication. But if you come in with a chronic problem, we still treat you like it's an acute problem. We're just going to treat you for that one condition, say it's hypertension, and you're just going to get a medicine for hypertension. And nobody's asking, why do you have it? Is there any way we can get to you not having this condition? Or, because all we're doing in regular medicine is just giving you medicine, right? Just giving you something that brings that blood pressure down. When, it could be anywhere from a nutritional deficiency to endothelial dysfunction to, it could be you're stressed out, right? But nobody's asking the whys anymore. Stopped asking why.
Yeah, exactly. And in a way, it almost took, it takes, for me, speaking for myself, it took seeing that very huge, that huge disparity between health, in let's say in a developing nation kind of environment, and really highly, where you can really see the difference between health as we consider it here, at least. And maybe it's nothing more than just the basic, a lot of the hygiene issues, a lot of the food, nutrition, but you can see the disparity between that and medication, and saying, wow, this really isn't even getting close to the source of the problem. This is where we came in with all the water purification. It's like, okay, we could sit here and give them, whether you're giving them pharmaceuticals or herbs or whatever it might be as antiparasitics, it's irrelevant, because in 2 weeks they're going to have tapeworms again, or flatworms again, or whatever it is that's in their water, because we're not taking care of the source of the problem. And then bringing that back, and it kind of, it's the same thing. This is where I think I related so well to what you were saying, because it's like, it took me seeing that to say, that's the problem. We are underserved here in this country too. Like you said, we're doing the same thing. We just don't see the disparity isn't quite as large between health and disease, or maybe it's more gradual. I don't know, but we don't really, it doesn't stare us in the face quite as blatantly. I think in some ways, maybe that's it. But yeah, and so is that how you would describe? Maybe go ahead.
Yeah, well, and it was funny when I was dipping my toes in some functional medicine. And I remember sitting there thinking, I'm listening to these lectures, and I'm thinking, that can't be right. That particular lecture was on probiotics, of all things, and I'm thinking, that just can't be right. Surely somebody would have said something. I mean, how many years of training? You have medical school and residency and fellowships and, years and years and years of training. Surely somebody would have said something at some point in time that if I can get people to eat fermented foods, or they can take a probiotic, that I can get a lot of this GI symptoms to get better for people. And I kept thinking, that can't be right. And then the other thing that I remember just being, now looking back, is it the way that we're trained, and I'm sure you're the same way, Sam, the way that we're trained is you have this set of symptoms, that equals a disease, and that equals a drug. And that's how we're taught, and that's what we do. And it never, ever, ever occurred to me to do something different when I was still doing regular medicine, So somebody comes in and they have elevated blood sugar level, well, they have diabetes. Well, diabetes means you're going to get one of the diabetic medications. And it wasn't until I had been doing functional medicine for, probably a couple of years that I'm like, wow, I don't want to say we're brainwashed. That's a terrible thing to say, but just the way that we were trained didn't allow us to ask those questions, to take that further. And that was the biggest eye opener for me as I was going through training, that I could have been, I was that person not asking why, and didn't even occur to me at that time there was something more to ask.
Yeah. Exactly. I tell that story all the time about how when I got into med school, as you know, when I started in, and by that point I'd been pretty actively, I would say, working as a clinical herbalist, at least part-time, for at least 10 years at that point. Well, yeah, 8 years, somewhere in that range. And so I'd been really thinking strongly about the body from the standpoint of an herbalist. And so as soon as med school started, I immediately started having problems like putting it together. It's like, well, this doesn't make sense. Why is it that we're not even talking about the lymph system, for instance, or the immune system in terms of its causative aspects, or where it comes in, where it fits into this whole, and at that point I realized that medical, like you said, maybe it's not conscious brainwashing, but that the entire curriculum was based upon what pharmaceutical drugs can do, and then basically kind of reverse engineering from there back across those pathways to how we understand the pathology, or rather the physiology of the body, of the human body. So everything you learn about anatomy and physiology is related in some way or another to pathways of pharmaceutical medicine, or at least those are the ones that are most that are going to be the most relevant. So why teach anything else? And so, if you're not using food, if you're not using nutrition as part of your, first aid kit, or as part of your pharmaceutical, stockpile, or whatever, your magic, kit that you pull stuff out of, if you're not using that, then why on earth would you actually even study the physiological processes and pathways that are involved in figuring out what a disease is? So it's really,
right.
it's kind of one of those chicken and egg things that we've never really, gotten to the source of it in our training and our curriculum, for sure, in the last 100 years or so.
Yeah, and I just got off the phone not too long ago with the dean of the medical school here that I went to here in South Dakota, and I was talking to them. I'm like, we learn biochemistry, right? That's a class we take. We take it in undergrad, we take it in medical school, but we don't apply any of that knowledge, none of it. Because if you did, you would have to use food. There's no getting around it. But we don't, and so it's very interesting, and I can't imagine going into it with your knowledge of, and then stepping into that environment, because most of us go in, right? We went to college, we went to medical school, we didn't know anything else, and that's just all we learned. So I can see where that would have been a huge problem.
Yeah, it was. I mean, it was in a way, and I had to leave for financial reasons. I really had to choose between family or med school, and I chose family, of course, is why I walked away. But in retrospect, I'm very glad that choice happened. I mean, I wasn't meant to do it, and it would have been a really difficult. I would have to set everything I knew on hold for 10 years and then come back to it maybe 10 years later. That's probably what I would have done.
Right. Which is why I've been trying to get, I think there's more medical schools that are. They're at least adding some nutrition. I don't know if they're necessarily adding a whole lot of functional medicine, but they need to. That's the point where people need to learn it. And so, the pendulum's it's swinging. It will get there, and, hopefully sooner than later, but that's just the way it is right now.
Right. And I think so in talking about that, you kind of described, I think, in some way, in maybe not directly as, stepped out of definition, but you talked about really what functional medicine is then. Would you describe it as that? As it's really just getting to the source of
yep,
what
that's what I tell
is?
people. It's asking the why. Why? What's the root cause of, whatever disorder you have? Now, you pick up strep throat, you got strep throat. I don't really need to really ask why, other than, if you're getting it recurrently and if you have an immune problem. But you have cardiovascular disease, or you have kidney disease, or you have diabetes, or you're overweight or whatever. There's always a reason why. And that's functional medicine. It's just trying to sort that out, figure out what is kind of dysfunctional and push you back into a more balanced place in whatever capacity, whatever that means, whatever treatment that involves, whether that's herbal medicine or supplements or exercise or lifestyle change or, maybe even sometimes medication if we have to use it for short term to kind of push your body back into balance and get whatever was the cause to try to fix that problem. That's all functional medicine is, in my opinion.
Right. And that's that's a nice side of where pharmaceutical medicine, I think, can really play a role, is that there are times where the body is so far out of whack, so far out of balance, or the inflammation is just so bad or whatever it is, your body has no way of getting back over, once it's sort of like an example of it might be compensated versus, uncompensated shock, in trauma. And once you're over that line into uncompensated shock, getting you back over that line is very, very difficult. And so that's where pharmaceutical medicine maybe can play a role. And then, functional medicine and or herbalism, and lifestyle, all the other things that go into, basically what we call functional medicine can then pick up and do what it does so well.
Right. I'm not throwing the baby out with the bathwater. If somebody needs medicine, I'll give it to them, but I give it to them with the caveat that this is hopefully just a temporary thing until we can get to the bottom of what's going on. But you're right. There's times, and you walk into my clinic and you got a blood pressure of 200 over 120. I'm not gonna, I'm gonna have to do something. Right? We have to get that under control, and then we can start addressing all the issues that led you up to having that blood pressure.
Right. Yeah. Yeah. So, and I put here as a bullet point, how applicable and practical is it today that I wanted to talk about, and we've already pretty much addressed that. But I think right now we are at a point more than ever in at least in modern recorded post-agricultural human history, where this is absolutely, it's not just important in practice, it's imperative, I feel,
Yes. Yeah, so chronic disease is, they keep calling it epidemic or chronic disease, but it is. And we are now we're for the first time ever, our children are expected to have a lower lifespan than we are because of all this chronic illness that we're seeing at a younger and younger age. And I think that if we don't do something, it's not only going to kill us physically, but it's gonna bankrupt worldwide at this point in time, because it's not just here, but certainly in the United States, we're spending more and more and more money on these chronic illnesses, but we're coming at them, in my opinion, in the wrong fashion. We've got to step back and say, number one, this has to be put, a lot of this has to be put back on the patient, because it's their lifestyle choices that are leading them down this pathway, and they have to be involved. And so many times, I know in my clinic, people come in and they're like, no, doc, just give me a pill. That's all I want. And that can't be, we can't keep doing medicine that way. It's going to kill us financially and physically. So I absolutely think it's imperative. It's imperative that we adopt these changes and start putting them into practice and start teaching our younger providers and other healthcare people, and that we embrace all aspects of healing, whatever that is, because it all has a place, and it all has, it fits in, maybe in one person it fits in this place and one person fits in that place, but we can't keep separating them, I think. I think we do too much of that. Heck, we do too much of that just in regular medicine, with all of the ologists and, different specialists and all of that, where we're not, it's still a person. And we have to back up a little bit, take a wider perspective, incorporate other healers into it, and then charge forward.
Yeah, and I think another place where this comes in as being really applicable that we haven't even talked about is the recognition of environmental toxins and damage that we are doing to not only our food sources and water supply, right? Flint, Michigan isn't a standalone situation by any means, right? So
environmental toxins are just a huge problem, and they're not only destroying our health, our human health, but our animals and like you said, the water, and then the soil that we grow our plants in. All of that is culminating to this chronic disease epidemic, I think.
Yeah, right. We see that even in cases of pharmaceuticals too. I've talked about this before, but the antibiotics or hormones or the things we find in our water supply and our food supply. The experiment that was done, back in I think it was the mid or late 90s, the first time here in the U.S., where they took chickens and had them in different spots. And they had 50 chickens or so inside a barn, and another 50 that were in the cages, and then another 50 that were outside, kind of more free range. And they fed them, antibiotics that they normally feed chickens to bulk up their edible, their weight for food. It's really it's a financial consideration more than anything. And so within, it was months, I can't remember, but 4 months or something like that, the chickens that were outside that had no contact at all with the inside chickens had resistance to the exact same antibiotics that they've been feeding. And within about another 6 months or so, the family at the barn and the nearest family neighbors also were measured with the same antibiotic resistance. So, and they did the same experiment in Germany several years later, and I think over 2 years, and it was everybody in the village basically had that antibiotic resistance was being fed.
Right.
So.
Right. And we know most of our antibiotic use is in animals right now, and people seem to think that eliminates this antibiotic resistance problem for them because we're feeding it to the animals, but we're not. It's affecting all of us, and it will continue to affect all of us. And so that and destroying our soil and all of the microorganisms that go in that, so that we can't even grow food that will help us to, because obviously you have to have the right nutrition in order to help your body rid itself of these toxins that you're exposed to. So now we've got a double whammy going, that our toxin exposure is higher than it ever has been, and we don't have the micronutrients to help our body get rid of it because we're not growing healthy food anymore. And that's if you choose to eat healthy food. If you choose to eat McDonald's 3 times a day, well, you're even in worse problems. So. Right.
Yeah. Yeah. So it's huge. I mean, the functional medicine really goes way beyond just walking into a doctor's office somewhere. It's not just, and way beyond just lifestyle. I mean, it really goes into a community and earth-centered basic concepts around how we treat our soil, how we food and water, where it comes from, how we build our stuff, how we transport it. I mean, really, the whole thing comes down to a cultural, societal aspect of what we call health, but really, in more than health, just survival. Really, I mean, as a species, it turns into survival.
Yep, absolutely, absolutely.
So the big question, and for me, that I wanted to just talk to you about, because I think you've done a marvelous job of talking about and putting this into a curriculum, is kind of how do you feel that this, I know it can't be simple to break all of this information down into a curriculum, but kind of what's your general idea, your general approach as you're coming to that from a 10,000-foot level of how you feel it's easiest to take this information that you have and this wealth of clinical experience that you have and turn it into a course that people can start to understand and use, both, I think, just, anybody who's like, hey, I just want to have better health, all the way to somebody who's like, I want to be a clinical herbalist, or even people that are already maybe practicing licensed healthcare practitioners that just want to have nutrition that are also taking the course.
Right. Well, and I think, like you said, from the 10,000 foot, looking down, I think there's 2 major areas that I think need to be taught. I really, really firmly believe we need to embrace this in our healthcare professions, all the way, nursing and medical school and all those, the new up and coming providers need to hear this early on, as we said before. So that's one piece. And I think that's going to be a harder nut to crack because how do I say this politically right? So there is a lot of resistance. There is a lot of funding for pharmaceutical and surgical interventions, and there's a lot of that sort of who's in bed with who kind of thing in medicine. And I think that trying to get teaching facilities to embrace this is probably going to be a later step, I think. Now, having said that, I have there's a lot of doctors. As a matter of fact, I'm training a couple of them right now that have gone through their full training curriculums and are now looking for somebody who's doing functional medicine and how they can start to incorporate some of this into their clinic. There are organizations out there. There's the A4M and the Institute of Functional Medicine, both that will teach all kinds of healthcare providers, and those are growing. When I started, there was about 25 people in my class. The last one I went, there was probably, 2,500 in each class that I went to. I mean, it was huge. So that's the I think that's one piece, is how do we get our young up-and-coming providers to understand that there's a different way to look at medicine. It has to be a paradigm shift with that. It just has to be. The whole concept of how we teach medicine has to change. That's number one. But number two, and the bigger one, and the one that I feel incredibly passionate about, is how do we teach everybody how to take care of themselves? Because ultimately they're the ones that are going to make the everyday choices that are going to lead to their better health, and if they make the right choices, are going to lead to a better environment and, a healthier environment, and so on and so forth. So that's the group of people that I'm trying to get to, and if that's one-on-one in my clinic, or if that's in a group session, which is what I actually prefer, where I'm teaching more people, just the importance of food, or like you said, the importance of understanding or just recognizing that our environment isn't as pristine as we'd like it to be, that there's all kinds of things that we're being exposed to. And maybe those people will talk to 5 other people who will talk to 5 other people, and we're getting this groundswell of people. And I can't go anywhere, Sam, if somebody asks me what I do and I start to tell them that they're not hugely interested in what functional medicine is, what herbal medicine is, how these things, how they can take care of themselves, because with Obamacare or not Obamacare or whatever kind of care we have out there, the bottom line is people have to be responsible for their own health care and keeping themselves as healthy as possible, and only utilizing healthcare systems when they really need to. I shouldn't say when they need to. When they've got a condition that warrants those sort of pharmaceutical or surgical interventions.
That's correct. Yeah, because the system does not catch these things. It's not designed to. I mean, the system has many, many flaws. We could probably talk for a year on all the different flaws it has and still not even come close to getting to all of them. But one of the big flaws is that it's designed for around the illness and or disease that's at a stage that absolutely has to have. Somebody comes in it comes into the doctor's office or comes into the emergency room or whatever it is, it's because they have something going on that's severe enough to where they noticed they have to take care of that, right, generally. And then
right.
You get this whole aspect of all the things that happen outside of that are, nutrition related and lifestyle related. So if somebody comes into the ER because they have shortness of breath, and they been smoking for 40 years, and they have chronic high blood pressure, and they've been eating nothing but McDonald's, and they're 200 pounds overweight, there is not a single pharmaceutical in the world that you can possibly give them that's going to take care of the root of that problem. Of course, it's asinine, and the system is set up for being able to give people something to take care of the problem on the spot. So there's just this vast amount of kind of holes that people fall through, or this vast amount of space that's not taken up by insurance companies and ICD-10 codes and doctors' offices and ERs, because number one, it's not designed to. Number two, it's really that entire system is in itself, in my opinion, is not even it's kind of a fallacy, honestly. But aside from that, just where do we take up those gaps? How do we take up those gaps? And the answer is absolutely the individual has to learn, has to be educated and not ignorant about not only their own body but all the actual aspects of health around them that are all the things we just talked about. So, I mean, I can't imagine any aspect of any type of medicine more than functional medicine that integrates more into the practicality of day-to-day life, and so the big question is just how do you, like you said, how do you actually teach that to everybody, right, to the people?
Right. Well, the really exciting thing is that I used to think people didn't want to change, but I don't think that's it. I think they don't know how to change, or they don't know what to do. I mean, I know when I talk to people about diet and say maybe what its effect would be on your child's behavior, for instance, like ADD, ADHD, or just obstinate behavior or whatever, telling them that their brain, that little kid's brain, may be on fire from something that they eat, and they had no idea that was what might be causing it, and they are hungry for that advice and are willing to make those changes in the diet. They just don't know what to do and have never been told that, because we have you go to your doctor, and like when I was doing family practice, I had 6 minutes to see a patient. Well, I have longer to talk to my mechanic about what's going on in my car than I do, than I ever did with a patient. And you're not, in 6 minutes when you got 40 other patients to see, you're not going to ask them about what their diet is, and you're not going to ask them any other questions other than what medication do you want me to write for you? That's it. That's all you have time to do. And, we know that probably, I don't know, just guessing, but it's probably 75 to 85% of people's problems that come into primary care have something to do with stress. People are complaining of vague symptoms like fatigue, and those are the ones where they need this education on what's going on in their life, and they don't need a drug. Right. So, okay. Off on a tangent. Sorry.
Not at all. And I don't think that's a tangent at all. It's exactly it. It's right on point. My question kind of was, and this is a question that, isn't open-ended, this isn't anything we're going to necessarily answer here, but, where does it intersect with herbalism and plant medicine? Because that's what I think brought us together, and there's definitely a huge, kind of a Venn diagram overlap gray area where these two areas do not only intersect, but they totally complement each other, and you can move because, we can always say that really the nutrition, that plants can be power food all the way up to being poison, and somewhere in that spectrum, we have herbalism as well, clinical herbalism, and it is an adjunct, or an adjuvant. It is it's a helper. It is also sometimes the best form of actual treatment. I don't like to use the word treatment, but it really is, helping the body heal itself from even acute conditions. And then we've got this whole support system of herbalism behind it, or of nutrition behind it as well.
Right. Yeah, no, absolutely. I agree with everything. I think the thing that made me so happy when I met you and started talking with other people that were doing herbalism, and even other people that were doing, maybe some more acupuncture or other aspects of healing, was that you guys were asking the same question. So I think herbalism and functional medicine absolutely overlaps in this idea of we have to understand the lifestyle choices that people are making. We can't ignore that, and both of us are asking the why. Why did you have that headache? I'm not just going to give you a plant. Or I'm just not going to give you a medication, whichever extreme you're at, but we're asking the why. So there's definitely overlap in that. I know a lot of functional medicine is using herbs, but I know I've talked with you about it before. My experience with herbalism, even from a functional medicine standpoint, was more as a supplement. It come in a bottle, and I didn't realize until I, taken some of your classes what a powerful thing it can be, making it in a tincture form or, as a salve or whatever. I mean, so I think functional medicine has a lot to learn as far as where herbalism can play in here, because I agree with you 100%. If there is a way I can make it as the first line treatment, and I'll use treatment because that's the only thing I know, but it is, in my opinion, the best thing that we can use, because that's what our bodies will use it appropriately. They'll take it and use it how they need it rather than be forced as they do with the pharmaceutical. So now the place where I think, and you may agree or disagree with me, I don't know, Sam, but I think the place that herbalism, I tend to feel like I push a little bit more is on the supplements, and mostly because I can't get it from an herb, or I can't get it from a plant, or I can't get it from the diet, and I just feel like we have to have a certain amount to overcome if we've got a clear disease process going in there. And so that's why I think that those are probably the two areas where I think that herbalism separates. But there's certainly the overlap is huge.
Right. No, I totally agree with that too. I think there are places where you really have to get the supplements. That has to be a part of it too.
And it would be, I'd like everybody's to be short term. If somebody's got, a glucose problem, and, I know they're going to be chromium deficient. I know they are. I know they're going to be magnesium deficient. And, if you could come up with a plant that would give them enough chromium and magnesium to reset those parameters, that's fine. But otherwise, it's a short course until they're not producing so much insulin. Their glucose is being, pushed through the appropriate oxidative phosphorylation and electron transport system, and it's not overutilizing those supplements anymore, then you no longer have to use them. And that's what I tell all my patients is this is short term too, until you can make the changes in your life and you can get the dysfunction back to imbalance, and then you don't need them anymore.
Right. It's sort of like the same. It's an analogy or metaphor for what we just talked about with pharmaceuticals, except not as what would be the word, strong or severe or whatever. But yeah, supplements getting
Right.
us back into the point where we're at least in balance enough we can start to work with that now. Yeah, totally.
Right. Right.
Totally.
So, but yeah, I mean, I would say the overlap is far greater than, it's like this little, and I only know because, man, I really felt like when I talked with you, I just didn't have any herbalism training at all, and I'm surprised that in my functional medicine training we didn't learn more about it. But they do have, there's a whole module now in the A4M, whole 4-day, 12-hour-a-day module just on herbalism that's just been added.
Yeah.
So they're getting it.
Right. Yeah. It's it's good to see. It's awesome. It really is.
Yeah, it is.
It
really is.
This is one of those things that gives me a great amount of confidence in what we're doing along to kind of offset a lot of the times of discouragement that happen.
Yes.
But look, I wanted to talk a little bit about your course. Then we got a few minutes to kind of to at least just chat about it. And this doesn't have all the subjects, but the Functional Nutrition Course 1, I've got this and on another slide too, just so people can kind of see, some of these general areas that you're covering and several more that will be on another slide. Is there anything you'd like to say about the general curriculum, kind of these pieces?
Yeah, so the functional nutrition part 1 really is just, I don't want to say, I'm not saying boring, but it's like you have to have information, right? You got to learn what a carbohydrate is and what a fat is and all that, and that's what that is. But then we throw in some micronutrient deficiency issues and soil, which I think a lot of people don't understand. So that's that, and then the part 2 is going to be much more clinical. Like, how do we put these things into practice? How do we make you feel better by knowing this information? So that's kind of how I've been explaining it to people. And
part 2 is also get into, I know we were just talking about this, there's going to be a portion of it, or at least one class of it, that gets into blood work and talks about understanding blood,
Yeah,
that, right?
Again, because and luckily, there's kind of been this swing in here in the United States where people can go down and they don't have to have a doctor's order anymore, and they can get some blood work done, and that's great. But what do you do with that, And I would tell you that probably even when I had gone through regular medicine, I wouldn't know a lot of the stuff that I'm going to talk about in the lab interpretation, because I think that what we call abnormal in regular medicine, what we call normal in regular medicine may not be optimal, and so that's really, really true with, say, glucose levels and thyroid levels and all that. So we're going to get into those as well and give some specific parameters so people know what to do with their labs when they get them back. And even if they're followed by, their primary care, that they can open that conversation up with their primary care and say, hey, I think that this is early enough that if we do something now, I won't end up with a disease later on. And that's the whole crux of functional medicine, right?
Absolutely. Yeah, I don't think we can overdo that either. If we, certainly from the standpoint of clinical herbalists or people or herbalists that are on the clinical herbalism track at our school anyway, I think they're always interested in learning more about blood work. We may have to have a separate course taught by you all together on this too. This just really gets a little more in depth into blood work if we need to, how to read these tests and what those mean.
Yeah, and and just even knowing that they're out there, like I use a lot of functional medicine testing. So maybe nutrition testing or food sensitivity or gut testing, things that your regular doctor's not going to talk to you about. I wanted at least our students to know, hey, these are out there, and either I get my primary care doctor to order them for me, or I find somebody who can, because I know enough to know that, say, for instance, my gut isn't working right, and maybe there's something I need to be looking at that I'm not going to get from traditional medicine.
Absolutely. Yes, very good. Well, as you can see here, viewers that can see, some of the other subjects that are on here, aside from what was on this previous slide, some really interesting stuff here, right? I mean, it's we start to get into some of these things are repeats for some of the students that have been through my gut classes, but things like small intestinal bacterial overgrowth or fungal overgrowth, and gut dysfunction in general, gluten and gluten-related problems. Of course, I know you get way into the gut-brain connection we've talked a lot about, and that's getting that from your perspective, from as a functional medicine doctor, I think is absolutely crucial, because you see it and you've worked with it on a clinical level for from the start, and that's what you've done. And so I think people need to hear it from that standpoint and it's much more potent and much more powerful than hearing it from the standpoint of an herbalist who's really, we work a little bit with nutrition where we can, and I know there are some herbalists out there who work a lot more with nutrition than I do, for sure. But the way I see it is, there's some basic tenets of nutrition that I can kind of pull out and say, okay, this and this and this. But to really to look at the details the way that you're looking at it, and look at the blood test and say, yes, you're deficient in this, or we should work at that, is a whole different level, I think, of clinical, of a clinical approach.
Right. Well, and I think that's where the combination is just, is outstanding, is to get both the herbalism, the herbalists and functional medicine together, and saying, okay, this isn't a competition. You guys have this, we have this. Let's merge them together. Let's get everybody with as much information as they possibly can get, so that they can, better take care of themselves or their families, etc. Sam, I did want to point out on here, just for the people that are watching this, that the autoimmunity, I totally ran out of time last time, so autoimmunity is going to be in part 2. It was not in part 1. There wasn't enough hours.
Right. Okay, well, good. So that's in part 2 then. Mm-hmm. So for folks who didn't get this before, let me go back up to here. So this is our 5-week online course, and we are now. What are we in the first? We're in the first week right now of it, or incoming?
Yeah, we'll have
the
the first live course. Well, the first live meeting next Tuesday.
Next Tuesday, okay. So starting up next week, and it runs for 5 weeks. And this would be a precursor. Now, I don't know if we've decided, I'm not the person to make this decision anyway, as to whether this is required, if they want to take part 2 or not. Do you know?
I don't know, but you know what? I would probably, I would say that if you've not had any nutritional training at all, that you would probably want this, because I'm going to be referring to a lot of these courses, or a lot of these classes that I already taught in my part 2. But say you're somebody who has a lot of nutritional background, you could probably jump into part 2. It's just that there's going to be a lot of referring back to those classes.
Right. Okay. So yeah, good idea anyway, to have it. Excellent. Well, good. I think, cool. Anything else that you'd like to say about this?
No, I think that was good. You let me chat away. That was awesome. Thanks, Sam.
Yeah, it's great to listen to you. It's great to talk to you. And this is something that I am really thankful that we have you as one of our faculty, Kyla. So I know I've probably said this to you before, but let me say it again in public so everybody can hear it. I think you're an awesome teacher. I really enjoy the way you teach and the way you break up your curriculum. And we've had nothing but amazing rave reviews of anything that you've taught for us. So I appreciate that.
Okay, thank you so much. I appreciate it.
Okay, well, this wraps up our videocast number 2. We'll see you around for the next one. Thanks, everybody.
Thanks. Bye.